Hey everybody, this is Dr. Joe Borio with this week's Change Your Health, Change Your Life. I want to talk about a specific concern, health issue. It's very ill-defined by its standards of diagnosis. It affects children, certainly probably the most precious group of people in our society, and it sometimes can be heartbreaking and significantly disabling, and certainly costing us a lot of money, both in our school system, and then we use a lot of money to treat with drugs, which I'm 100% against. So we start to look at this, and that's that attention deficit hyperactivity disorder. And you know, we can, there's a lot of different ways to go with education and how children are meant to be educated and so forth, and there's a lot of different discussions we can get into, but let's just, you know, for the sake of time and what's most important, let's look at the nervous system of a child. Essentially, a nervous system in both a child and an adult is a computer that has messages that go out, if you will, to a monitor, if you will, or your keyboard or a mouse or whatever, and that information, when you move a mouse or a keyboard or a pad, touchpad or whatever, that information has to go back into the computer, and there's a constant flow so the computer knows what's going on. And that's how our brain and nervous system work. Now, what we forget about that is your nervous system's also communicating to everything else. So it's talking to your liver, your lung, your kidney, your pancreas, your large intestine, your small intestine, your gallbladder. I mean, so, and that defines our health. So the better your nervous system can talk to your body, and the better the body can talk to your brain, the healthier and better you or your child will function. I mean, that's a scientific fact. There's no question in that whatsoever. And now when we start to look at children with these disorders, if you will, sometimes they're called developmental, sometimes they're called neurologic issues, neurologic challenges, what we're seeing is that their ability to regulate their brain or neural efficiency is diminished. What the heck does that mean? That means that my brain is using a lot more of itself, many more parts of the computer, if that makes sense, or I'm using, if I got an 8-cylinder engine, I'm using all 8 cylinders in my brain when I only need one, if you will, to perform a task. I'm using a lot more of my brain to perform certain things, and that's inefficient. So neurologically, my brain becomes inefficient, and therefore what we see with some of these children is they tend to become more active or hyperactive or having an inability to focus on things as well as other children. Now there's arguments of, you know, is it good to have children setting versus moving around? There's arguments of, hey, are they playing too many computer games? Are they watching too much TV, and where bits of data are given in small increments, so their attention deficit, if you will, their ability to pay attention is shortened by that. I would say that there's truth to every one of those aspects. There's no doubt about it. But in this case, I want to talk about what we can physically control in the body, and that is the health and integrity of the nervous system. What we know that scientifically with 100% certainty is that the less data that comes in from my body's periphery, so by touch, we're going to call it kinesthetic, by learning, if we touch something and hold something, you know, there's data that comes in, what it feels like, the shape of it, you can close your eyes and almost tell and identify an object and so forth. When we know that that's diminished, the activity and efficiency of our brain to process in not only our cognitive skills, but our memory skills, our ability to pay attention, they get diminished. So the less data, electrical neurologic data that I have that can come into my body, the less that I have, or the more inhibited, the more resistance that there is in my body to send that data up, I'm much more prone to becoming neurally inefficient or develop conditions like attention deficit disorder or having a hyperactivity type personality or behavior. And that we know factually. So one of the things that we need to look at critically is, hey, what is the path that we use to send electrical data from my hand into my brain? Where does that have to go? So if you think about it, I've got all these little nerve endings on my hand, and that data, electrical data, comes up my arm, it goes through my shoulder, into my spine, and then from my spine it goes up to my brain. If my brain wants to send data down, what's it going to do? It's going to send electrical information, or a thought, if you will, down from the brain into my spine, down into my arm, into my hand, so I can open and close and perform certain activities like this. So what we know is that if the spine loses a mobility or alignment, so if the spine's crooked or it loses the ability to move, so it becomes fixed, if you will, or stuck, and maybe restricted of movement, maybe it still moves a little, but it doesn't move as well, then we have less neurologic information, data, bits of messages, bits of commands that can go into my brain or down to my body. That data gets lost, and then therefore a child or an adult is less likely to be able to use neural efficiency. I'm much more likely to become hyperactive. I'm much more likely to have difficulty paying attention or focusing, because my brain is using so much of itself to perform other activities. It's going to be, okay, I'm doing this, wait, I got to focus on that, hold on a second, I got to do this, and it makes it much more difficult for the brain to work as efficiently as it should. So as a chiropractor, our concern is to identify and locate specific areas of the spine that are either crooked or have lost normal mobility. And that condition is called a subluxation. Subluxation is a word very specific and unique to a chiropractor, much like gingivitis is to a dentist, or arterial sclerosis might be to a heart doctor. Chiropractors are focused very specifically on segments of the spine that have lost mobility or are crooked and then affect the nervous system. So messages can't come in and messages can't go out, and then we have a loss of neurologic function, and that body part or that part of the brain or whatever starts to change in how it was made to run. It doesn't work as well as it's supposed to, and it doesn't work as efficiently, and therefore in children we may see many different things. One of the things we see very commonly is that attention deficit disorder or that hyperactivity disorder. So what we do is we need to look at children, and it's best to check early in life any areas of the spine that have lost mobility. Now we know, especially now more than ever, through the birth process, we see more births being invasive, meaning that we have births that are stimulated either by water being broken, if you will, the cervix being added medication to. We see IV medication with like Pitocin. We see forceps. We see vacuum extraction. We see a lot more C-sections. So we see children under much more trauma to the spine than ever before. And what's amazing, and most people don't think about, is really the most stressful activity or action or event that a spine will ever endure is actually the birth process. So that's why certainly in our office and the chiropractic profession insist on checking the alignment of the spine in a newborn as soon as possible, because we don't want there to be any change. Think of it like a dimmer switch. We don't want there to be any decrease or reduction or loss in that healthy nerve function that is going to map out the brain. It's going to map out the brain. Remember, the brain is like a tablet, Egyptian tablet, where you're going to push, impregnate different thoughts or messages in it. It's called a neural impregnation. So if we lose that data, the message isn't pressed as deep in the clay, and therefore we're less likely to have that as a foundation in how our brain works, how it functions, how efficiently it functions, our memories, our cognitive skills, our speed in which we're able to process data and assess data and spit it back out. That all starts to lessen if I lose that flow of normal information. So one of the things, again, there's other factors. Nutrition plays a role, the environment in which I grow, but as a chiropractor, our concern is to identify those areas of the spine that may be out of position or lost mobility, and then through a gentle adjustment, put pressures very specifically, scientifically and specifically, on that segment to reduce, sometimes you can't ever fully correct it, but to reduce the misalignment or improve the mobility so that you get as much information through the nerve, and therefore the child then becomes much more neural efficient, and therefore their brain works much better, and therefore you're going to notice the state of a child will calm down. And that's what we see. If we see loss of normal nerve flow, the child becomes in a stress state. The child becomes much more active. Their blood pressure goes up, their heart rate goes up, their breathing rate goes up, their digestive system will actually decrease to some degree. Their immune system will actually decrease to some degree. So we start to see a lot of different changes in how healthy and well a child functions, and that being true with an adult as well, if the nervous system isn't working as well as it's supposed to. So when we talk about attention deficit disorder or hyperactivity disorder, one of the ways to ensure that your child can prevent the development of it, or if your child is evaluated and diagnosed with it, a great natural, very natural approach to helping a child work normal from a neurologic state is to have them brought to a chiropractor that specializes in working with children, so that you can look specifically at those segments to find out any one, it only takes one, any one area of the spine that may lose that mobility or alignment, and improve that function so that their function will be improved. In closing, just to give you a clear idea how dramatic that is, that neural impregnation is something, that foundation of a house, that a child will develop into a teenager and an adult will build upon. So their ability to problem solve, their cognitive skills, their memory, every aspect of who they are and who they become is dependent, critical, is dependent on a healthy foundation, that neural impregnation, neural efficiency of their nervous system. And that's why it's so important, whether your child has this problem or challenge or not, to have every child checked immediately after birth to ensure that their spine and nervous system is as healthy as it can be going forward, so that child, your child, can be everything that they were meant to be. Guys, this has been Dr. Joe Borio, this week's Change Your Health, Change Your Life. Don't forget, you, your mother, your father, your grandfather, everybody in your family needs regular chiropractic care. Check the alignment of the spine. Make sure all the messages from the brain are going to the body, and the body are going back up to the brain. Have a great, healthy week. Talk to you guys next week.